Welcome to episode 4 of How to Become a Doctor. If you haven't joined us for the last 3 meetings, or I know there's a lot of you out there watching the recordings, which is great as well. Definitely check those out. It's on our Phase Moodle page. You can also see them on the Instagram. We've gone over the competitive applicant week 1, your timeline, and MCAT DAT prep week 2, and then Mr. Robbie Bowen, our director, went over the resources out there for you and what you can trust last week. So once again, if it's your first time, my name is Matt Duras. I'm one of the pre-med advisors here, and I co-lead this with our director of pre-health program, Mr. Robbie Bowen. We trade off who leads the talk. So today, I'm going to be leading the talk, and the topic is gaining clinical experience. And so I'm going to do about a 15-minute presentation, and then afterward, we have some questions prepared. If you're here live, you can also ask questions, and we just want to, make it short and sweet, but also be comprehensive. So here we go. The golden question: what clinical experience can I gain? How do I gain it? That kind of thing. So here's the thing. When you want to go to medical school, the first thing we talk about is you want to make sure you can handle medical school and prove that to them. And that's your academics, right? And so we've already talked about that. You want to make sure that you have that high GPA in the science and overall have that high MCAT. But the thing is, after they can see that you can handle medical school, the next thing they want to know is, why do you want to be a doctor? Do you know what you're getting yourself into? And so here, you're going to prove in your application that you know what it's like to be in the medical field. Yeah, you've never done a surgery before, but if your only idea of being a physician is from Grey's Anatomy or from your uncle who's a doctor, they're really saying that's not enough, because they want you to have that front hand experience, that your eyes, your ears, your nose in the clinic, right? And so, the big thing, I'm going to show you some different examples out there, but the big thing is that there is no magical job that lands you in the medical school, right? Some people say, well, you have to be a scribe. You have to work at a clinic. You need to do that. There's no special role out there. The biggest thing, and we're going to talk about this, is 2 things you want to focus on. Number 1, which is the most important, is gaining patient contact. So basically what we're talking about is, just being in a hospital and having, your feet on a hospital floor. That's not going to do it, because if you're in the corner studying at a desk and you're not doing anything, medically related, well, that's not enough. So what the first thing they're going to want is that patient interaction where you're actually talking to patients. Once again, you're not licensed to be doing surgeries, that kind of thing, but are you actually talking to people who are sick? Are you maybe you're doing intake, maybe you're working as a medical assistant or a CNA, maybe you're working as a scribe, maybe you're volunteering in patient transport, but are you contacting patients because they want to know, hey, tell me a story about a patient without using their name, something that impacted you. The second thing that can be very helpful outside of patient contact is being around physicians. And so if you can be in some sort of role where your eyes are on physicians, you're at least seeing what they're doing, that can be helpful as well, because you can basically, see what you'll be doing one day if you become a physician. Now, some people separate these. Some people do shadowing, and then they go do the clinical experience. But remember, if you're just doing the shadowing, you're not actually, necessarily talking to patients, so you might separate them out, but the thing is, maybe try to get a role where you're around physicians in some sense and you're gaining that clinical experience. And so that's kind of my opener there. We want it to be meaningful. We want it to be something that you could talk about. We want it to be something that's significant enough that on the AMCAS, the medical school application, you can write about. But get creative and think wisely about some ways you can interact with the medical field. So I want to show you a resource we have. Many of you are probably aware of this, but we have a pre-med website. So if you go there, lsu.edu/science, this brings you to our science website. Under the student tab, you can see pre-med, pre-dental resources. So this is our main website. We went over the timeline in week 2. We've gone over different things. Well, we brought you to the Moodle page, week 1. And here, last time we were at the Moodle page, we were talking week 1 about being a competitive applicant. And one of those things, of course, is clinical experience. Well, I want to move you here to the clinical experience opportunities tab. So if we click that, we can see that we talk a little bit about what I said before, that direct patient contact and, being around a physician, being around a dentist, being working, talking to patients, interacting, but we actually have some examples of things people have done in the past because you might, need to get creative. So we have them kind of ranked here, by maybe how intensive they are, how much training you need, opposed to maybe easier or less intensive. You don't have to do the hardest thing out there, but just know that. So at the bottom, we do have shadowing. This can look good for medical school, but it's probably the lower commitment. Here you can do volunteering, which I'll show you some of the hospitals we have you can volunteer with. This can be great. Just for getting your foot in the door. If you have a busy schedule, you could, volunteer in a patient transport role, in surgery waiting desk, anything like that. Volunteer at a free clinic. The crisis hotline is called the phone is one example. Maybe you can do a summer or spring break trip, Atlantis, where you go around the world to different countries and travel, and a few different ideas there. Mission trips can be great. This is another one a lot of people don't think about is hospice volunteering. This is great patient interaction because, that question of how, do you know how hard the medical field is to work in? Well, hospice is one of those harder settings when you're facing some really challenging situations. Scribing, that's an idea, a job many people like to do. Phlebotomy, we already talked about patient transport, working with home health, eye bank technician, EMT, emergency medical technician. This would be you have to do a 12-week training course. Just keep that in mind. EKG tech, work with the coroner's office, CNA, or a medical assistant. So this is not an exhaustive list, but it does get you an idea of just some of the types of roles that our students have done before. Now, remember, you're not doing your clinicals right now. So you don't need to have, worked with 12 different types of physicians out there. Some people think, oh, I need to be with a dermatologist and this and that. Sometimes we would rather you have less experiences that are really deep than a bunch of different shallow experiences where you only were here or there a few hours, So remember, they want to just make sure you know how to talk to people, how to deal with the sick and the struggling patients. You've put your eyes and ears on physicians before that while they're in the clinical setting, so you can kind of see what their day looks like. But this is a good idea to look at. But, maybe you're saying, okay, I'm interested in those kind of things. What can I do? Well, we do recommend you connect with AED, Alpha, Epsilon, Delta. They have a website. That's the Pre-Med Honor Society at LSU. And on their website, they post jobs. We recommend you sign up for our email list at the College of Science because Mr. Bowen, our director, oftentimes, even today, emailed out something. You can find that under the listserv right here, join the medical dental list, one of those, and you can find out about a dental clinic that's hiring or a hospital that's hiring. So definitely do those. Check out AED, look at our opportunities, network with your own physicians and friends. But we also do have a few ideas on here as well with Scribe America, Physician Assist, a few links on our Moodle page. And then as well, if you look under volunteer opportunities, we have a few of the hospitals linked. And so, we have Baton Rouge General, a few other ideas out here. Some of these are more medical related. Some of them are not. So we have the Hospice of Baton Rouge, Red Cross, Suicide Prevention Hotline, Ochsner, Our Lady of the Lake, St. Joseph's Hospice. So, check these out, Women's Hospital. These are all great opportunities. We have a lot of hospitals in Baton Rouge. And then we as a pre-med advisors also have some different ideas as well. So you can meet with us. Our appointments open up at 9 a.m. On Friday mornings for the next week. So you can schedule with us, shoot us an email, help us connect you. But if you start with even the resources we show today, this should help you a lot. And there's even some virtual options out there. If you're someone that says, hey, right now I don't feel safe, maybe you're immunocompromised, you don't feel safe going out and about. Well, there's also some virtual opportunities that you can at least get your foot in the door, build those hours, build those experiences that are meaningful. So we definitely encourage you here to do that. But we also want to remind you that your motivation should be out of wanting to learn and wanting to grow yourself as a person. Remember, if your chief motivation is just to pad your resume, just to get those hours, it's going to be a little bit harder. So you're going to want to make sure that you have a good motivation. But the other thing we want to remind you of is make sure you're documenting your experiences. When you go to apply to medical school, you need to be quite descriptive with your hours you're documenting. You need to talk about who's a who's someone that they could call to verify you worked there. What kinds of roles did you do? What skills did you do? So if you're doing that all off memory, but you did it, your summer after freshman year, that's going to be hard, and you're going to have more ranges than exact hours. But, if you come to our clinical experience opportunities page, we give you some experience documentation tips. And here you can actually, while you're working, record those hours in an Excel spreadsheet, put that down, that information, that contact person. Write down, maybe a story of a patient that impacted you. What made you say after the end of that day, man, I want to do this. I want to go into medicine. And then as you're doing this, we're going to talk a lot about the personal statement this spring, especially at our personal statement workshop, which we also have recorded from last year under our presentations tab on Moodle. But we're going to talk about tying this in, getting that clinical experience, taking those stories and tying that into your personal statement, so that in an interview, when they ask you in your dental school interview, they say, hey, well, why do you want to be a dentist? You're not just talking about how you love, helping people, but you could share about, a certain patient that, they came in, sad and upset because, they were just insecure about their smile, and, you got to assist the dentist that day, and they left smiling, and they're so thankful for that time. And you want to, give so many other people that smile. Or maybe with medicine, you volunteer with hospice, and, even though the physician, did all they could, and they couldn't save the person, you were still able to help with that palliative care and encourage them in their last days. And that you want, whether you can save their life or not, you want to be there to help people in their hard times. Those are the kind of things that they're looking for, right? They want to make sure that have a clear picture of what medicine is, of what dentistry is, of what optometry is, and that you're not just basing it off of what you read online and what you discover. So there's a lot to say here, and yes, it is hard to network and find opportunities, but at the same time, if you use some of our opportunities and ideas on Moodle, if you network through AED or other great clubs on campus, there's many great medical clubs, and PDS, Pre-Dental Society, free dental applicants, pre-optometry. But also, connect with us. We can help you be creative. We have a lot of different ideas. So that's the presentation right there. There's a lot more to say. You can follow up with email, but I do want to open up for any questions we have, and I'll have Mr. Bowen read those.
Yeah, so what we've done is sort of compiled a list of the most common questions that we get asked about things of this nature, about clinical experience and things of that nature. So I'm going to just tell you the question, and we're going to try to respond the way that we normally would if you were here with us. So one of the most common questions that we get asked a lot is, how many hours do I need? Like how many shadowing hours do I need? How much clinical experience do I need? So, asking about, like, is there a minimum? Is there a total number of hours that I need to accumulate?
That is a great question. Mr. Bowen and I, we typically don't give a number out because, we want to say this. We always say it's quality over quantity. And what do I mean by that is, you could have 500 hours in a hospital, but, if you're at a desk in a corner, doing your homework for those 500 hours, well, yeah, you have 500 hours in a hospital, but, how are you going to talk about that? Maybe you have, a lot less hours than that. But they really meant a lot to you, and you really, you wrote down those stories and it impacted you, and you did all you could. That's going to be more meaningful. So, when it comes to a minimum, that's usually the wrong question, because remember, you're competing. So if you get the minimum to get in, but someone else goes higher than you, they might take the other person. So you want to do, the maximum amount of hours you can do while still holding a good GPA, getting that MCAT score, getting your sleep and taking care of yourself. But yeah, you definitely don't want to think on the minimum. You want to think about quality experiences that you can journal about, because on the med school application, you don't just put your hours. You actually have to, your top 3 experiences, you write a little essay about those. And so make sure it's something that you're enjoying, that you're able to write about. Make sure it's quality, but, really focus on the quality over quantity hours.
Yeah, and I'll just add, that's why it's important for the journaling or the documenting of when you do something, because if you're doing that, your freshman year, and then you're trying to apply at the end of your junior year, and you're trying to remember, when was that, what date, what time, when did I do that? But also, by documenting and trying to talk about, what did I get out of this today? Like, what did I see? What happened today that I noticed? What's something that stood out to me today? It's really helping you when you have to start your application and you have to write your essay about going to medical school, because the better essays always are bringing in personal experiences, things that you did. I don't think you're ever going to get asked in an interview, how many hours do you have of volunteering? It's going to be, tell me about your time at the hospital. Tell me about when you volunteered. What was something that you learned? Tell me about a patient that you interacted with. And so they're always looking for like the personal connection and, what was it about this experience that you took away from it, not just you checked off a box and got so many hours. So another question is, I have a job in a hospital. I work in a hospital. Does that count, or do I need to do volunteering in addition to that?
Yeah, it's a great question. A lot of you guys, it can be confusing because you do need to have that medical dental experience, and you also do need to have some sort of community service hours. So sometimes these are mixed together, but at the end of the day, remember, the money part isn't the big deal, right? So once again, like I said, you can be making $100 an hour and working at a hospital, but you're, sitting in a corner doing your homework, or you could be volunteering and, really talking to patients and interacting with them and helping them. So, if it's paid or unpaid, that the only difference is, whether you're going to get money in your bank account. But when it comes to admissions, it really matters, what are you doing in that experience, and get the best possible experience to prepare you. But yeah, so you don't have to have volunteer, you don't have to have a job. You have to have some sort of medical experience. And then also, it's good to have outside of that community service, but that does not have to be medically related. But we do typically recommend your community service hours to be, with people over things. So, if you could be, helping tutor, underprivileged kids, that might be better than, stacking cans at a food pantry. While, the food pantry thing can look good, if you can interact with those that, do need help, that can be helpful.
Yeah, if you're shadowing at a hospital and you're getting paid to work, a couple of shifts a week in the ER, you're going to get plenty of clinical experience in that. You don't need to go looking for other opportunities. You're gonna be fine there, even if all of those hours are paid. That doesn't matter. But if you have opportunities to volunteer or shadow, you have opportunities to spend a Saturday working for Special Olympics or doing something like that, and you can make it work. Absolutely. So just with the COVID situation, we get a lot of questions about that. Many people saying, I've been really trying hard to find something to do and I can't because of COVID or the COVID situation. And, will medical and dental schools take that into consideration when I apply, that maybe my hours are affected because of something like that?
It's a great question about COVID. And I want to bring you back to one of my statements before, um, will they keep it in consideration? Here's the thing is, with medical and dental school, they have a limited amount of spots and they're going to take the best students overall, right? Go back to week one, look at what they're looking for. So on one hand, they are going to take it into consideration because people are going to have maybe a little bit less hours or a little bit less opportunities. And so the best students might not have as many hours this year as in a non-COVID year. At the same time, we don't talk about minimums. We don't talk about what's the least you need to do to get in. We're talking about maximums. What's the most you can do? What's the best opportunity you can get? So don't think about, well, they're going to, give me a cop out because it was COVID. They have limited spots and you want to get one of those spots. So if you want to get one of those spots, you do whatever you take and whatever it takes. And think about this, what if you're having a hard time finding a spot and you call 20 different clinics and you get a no, and that 21st one, you get a yes. Well, that sounds like a great personal statement to me, that you were so determined to get that dental job that you can even talk about that you called 20 different clinics and it took that, 21 times to get that spot. That shows how determined you were. So I'm thinking, on this side of advising, to encourage you guys to use this to your advantage. Show that, you got this opportunity and what it took to get it, and that you were so determined that you had to send that extra email. You had to, network a little bit further, and it's only going to benefit you. But don't think minimums. Don't think, trying to get an exception. Think, how can I stand out amongst my peers?
Yeah, and we saw a lot of creative things. Students did a lot of things, they spent time trying to figure out how can I help? How can I be a positive influence in the community during COVID? So we had students who volunteered for agencies, senior citizens agencies, and they made phone calls to people who couldn't get out to make sure, do you have food? Do you have everything that you need during the when we were in shutdown mode? And so that was, that was a creative way to serve and to be engaged and to be helpful and to contribute positively to the community, even during, a pandemic shutdown type of situation. Other students volunteered at the PPE, where they were making the protective gear for medical professionals. They volunteered to pack those and deliver those to hospitals and things like that. So, just look for ways that you can be creative, and that's, stands out a lot that this student found a way to really do this despite all the limitations that they had. Next question is about, shadowing. Like, if most of my experience is shadowing, that's kind of what I've done. Is that okay?
Yeah, you guys are going to hear that shadowing word a lot. Because it's just it's a buzzword for pre-meds. And the positive side of shadowing, is that you are seeing the physician in their role. But like we said, remember, they're going to, shadowing can be a little bit passive at times, because typically if you're doing true shadowing, that means you're just watching the physician. So you're not contributing. So first of all, sometimes it can be harder to find shadowing because you're not giving anything to them and you're only kind of watching. So, we say, why not go so much further and volunteer or work at the hospital or work at the clinic, work at the nursing home, because, then you can be around, the physicians and actually be contributing. Now, if your hours are only shadowing, it's not a bad thing. Shadowing does not look bad, but we do encourage you, if you could pair shadowing with some sort of clinical patient interaction, that could be great. So maybe you shadow around a physician. Well, then, hey, just try to interact with patients, even if you're not working around a physician and you're just, if you're in a nursing home and you're working with nurses or CNAs, maybe that's a good pairing together. But think creatively how you can have some stories where you have been helping patients.
Yeah, I think the great value of shadowing is learning sort of the bedside manner, like how do doctors, interact with patients. And, you're going to see some doctors that you really admire the way they're able to communicate, and you might see some that you didn't really admire the way they handled it. That's all part of learning in the learning process. But also, it's usually a good foot in the door kind of way to get in. A lot of our students who are working in clinics or hospitals or whatever, it started out with a shadowing experience. They developed the relationship with the doctor or the dentist, and then it led to like a part-time job as an assistant in their office, or helping that way. So don't turn down an opportunity to shadow if someone offers you that and you can make it work, because you're always thinking about networking and how can I build other opportunities. So, we're not downplaying shadowing, but you need to do a little bit more active work when possible. So I think that's kind of the questions we came up, but I do think it's important that we talk a little bit about balance in your life, because sometimes what we see is that students have no clinical experience, which is not, a good thing. We also see students who are working 30 or 40 hours in a clinic, and therefore their academics are suffering for that. So, you need balance. And so you don't want to take on too much. You don't want to not have anything, but you don't want to take on too much either where you are not able to keep up academically. Nothing is ever going to take the place of GPA and test scores, the MCAT and things like that. That's, those are concrete, hard things that, are immovable. And so, when you're stretching yourself too thin and it's impacting how you're doing in the classroom, you aren't doing yourself any favor. So hopefully you can find balance. You can do something where you're working, hours that are still allowing you to do what you need to do academically. So, it's two sides of the coin. You want to make sure that you're balancing both of them. You don't want to be heavy in one and not have experience in the other. So just kind of keep those things in mind. Um, and, you know, hopefully you're motivated to do these things because you enjoy it. You know, that's the thing that stands out in an application. Like this person, I can tell from reading this person's packet, they want to be in medicine and they, you know, they love what they are pursuing. And sometimes we don't really see that in an application. It's just kind of like, does this person really want to do this? I'm just not seeing the evidence that they are passionate and enthusiastic and excited about this. It almost seems like it's a chore and a duty that they have to do. It's a list they have to check off. And that, you know, that is probably one of the things when our review committee looks at that, you know, stands out the most is like, I'm not getting the students' passion and excitement for what they're doing. It almost seems like a chore. So you don't want to do that. And, you know, that's the importance of getting clinical experience, because sometimes people may realize this really isn't what I want to do. You know, I had this image of what being a doctor or dentist was going to be, but I'm just not feeling it now that I'm out there doing it. And it's better to do that now than, you know, when you're already halfway through med school and, you know, are miserable.
No, those are some great reminders. And, you know, I do want to encourage you guys to go back to week 1, watch it to make sure, you know, you see that all experiences do matter, right? So leadership experiences, you know, campus involvement, other jobs, even like being a waiter or waitress, those kind of things, those do matter. They can market you well for med school, and you can use those things to show you that you're a well-rounded person. Today was the clinical side because you do need to have some clinical exposure, you know, just as Robbie mentioned, because you need to know, is this what you want to do? And they need to know that you have a clear picture of what dentistry, what medicine, what podiatry is. The thing is, just you're always going to be, you know, a full, well-rounded applicant or not to be looked at. And so this is just one piece of it. Make sure that piece of your pie looks at least robust enough. But, you know, as Mr. Bowen mentioned, you know, you definitely want to use that balance. You know, don't make all your, you know, you don't have to do everything clinical, right? You can volunteer, you can be part of things that aren't medical as well. You just want to make sure this piece of the pie is covered. So once again, thank you for joining us. We're going to have one last meeting for the semester in 2 weeks on Wednesday. Let me pull that date up for us. It's going to be Wednesday the 10th. And then 1 week after that, November the 17th, we'll have our first review committee meeting. So if you're thinking about applying this summer to start fall of 2023, then you're going to want to come to our meeting. It's at 5:30 on Wednesday, the November 17th, Thursday, November 18th, or Monday, November 22nd at 5:30 in Nicholson Hall. You can find that information on the calendar. We're going to be posted on Instagram as well. But once again, you know, spread the word about this this event so we can get many people there. And thanks for joining us.